Welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Usha Rajagopal, and we're here talking about a couple of different procedures today. Our next topic is Voluma. Hi, doctor.
Hello.
Voluma, I'm not familiar with this. What is this procedure? Or is it a procedure?
It is actually a product.
Okay.
It is a brand new product that's been FDA approved, and it's the only product that's FDA approved for the mid-face or the cheek area.
So how long did you say it's been out?
It just got approved.
This is amazing.
It got approved in November, and dermatologists and plastic surgeons are now getting the product in January. The company doesn't even have brochures out yet. It's that brand new.
Now, I had heard that you were a co-investigator on this for this product for the FDA. Tell me about that.
Yeah, that's correct. I was a co-investigator for the clinical trials for approval of the of Voluma. So I've been using it now for a while. I love the product. It is very easy to work with. Injecting technique is a little different than other products such as Restylane and Juvederm that have been out in the market. You see immediate results. What I love about it is, as you're actually injecting it into the cheeks of the patient, you can mold it. So you're kind of like a sculptor. You can actually sculpt someone's face and give them the volume that they need. It's amazing.
So is it just for the cheek area? Can you use it in other areas? Because I know that with fillers, people
Yes.
pretty much want to put them everywhere that they
Yes.
can possibly put them.
That's true.
What about with this product?
So Voluma is a hyaluronic acid filler, but its chemical structure is a little bit different. So it actually gives more oomph to the area. It has FDA approval for the cheeks, but off-label, you could use it anywhere. So you could use it along the jawline, the chin area. It's probably a little too much for the lips. You would get a little too much pumping. And the other area I wouldn't probably use it is underneath the eyes, but the rest of the face, I think it works amazingly well.
Who would be a good candidate for this type of product?
So this is for a patient who has volume loss in the face. So it can be both for men and women. Usually volume loss you start noticing somewhere in the 40s on over. Or it can also be for the younger patient who maybe is anatomically or genetically, they come in and they have flat cheeks, or they don't have a strong jawline, and this could be injected in those areas too.
Is this something that, let's say now that it's a new product and people know about it, would they come in and say, oh, doctor, I'm interested in having Voluma, or is this something that you would recommend to them if they were in having an appointment with you?
Both.
Okay.
So I have patients now, because they've heard about the product, really want to come in to get the Voluma done. And I do have patients who will come in and go, I usually ask them what bothers them, and then I'll assess the face and then give them recommendations. So Voluma is certainly in my armamentarium of products that I would use.
How long does this product last in the body? How long can somebody expect to see the results?
Yes. So with Voluma injector in the cheeks, the FDA has actually given the company approval for 2 years. So according to the FDA, in the cheeks it lasts 2 years. But clinically, as a practicing surgeon, when someone comes in, I'm going to say in about a year they probably need a touch-up.
Okay. Now, how long does it take to have the treatment performed in the office? It's an in-the-office procedure.
Yes, it's an office procedure. So the patient would come in. We usually offer topical numbing cream to the area. So if it's a cheek, then we apply numbing cream to the cheeks and have the patient relax for 30 to 45 minutes. And then we start the injection process. The injection process will take another 15 to 20 minutes. And once the injection's done, we recommend icing for about 24 to 48 hours, as much as possible.
Now, what about downtime? Everyone's always concerned about that when they go in for any kind of office visit.
Yes. So with this, I'm going to say minimal to none. You're slightly swollen. Rarely you can get a bruise. If you get a bruise, you're going to need to cover it up. But most people don't get a bruise when it's injected in the cheek area, and so literally they can have the sun and go out to dinner that night.
This really sounds like a wonderful option for somebody experiencing any kind of loss in their facial appearance. Doctor, thank you so much. It's great to have you on today. If you'd like more information about Dr. Rajagopal, you can call at 415-392-3333, or you can check her out on the web at sfcosmeticsurgery.com.